We're here with Dr. Joseph McCormick talking about knee replacements. Dr. McCormick, at what point is it determined that someone could have a knee replacement surgery?
Sure. It's when it comes to the point that it's impacting their day-to-day activity, work, and out-of-work activities that they enjoy doing. If you're not able to do the activities you want and you're saying no to more and more things with family and friends, then that's when it's time to consider that. That being said, obviously you have to have advanced enough arthritis that a knee replacement is warranted.
And what should a patient expect when they come in for their first appointment?
Sure. First appointment, you're going to be seen, you'll check in, you'll get some x-rays likely if they haven't been already obtained, or some additional x-ray views may be required to complete the assessment. And then a physical exam by one of my orthopedic colleagues or myself, and to determine how the knee is functioning. We'll look and assess range of motion, knee stability, and that combined with symptoms and the x-ray findings help determine when is time for the joint replacement.
What does Prevea Orthopedics have to offer when it comes to knee replacement procedures? They're not all the same.
That's true. We're lucky to have a number of orthopedic surgeons that are very capable in the joint replacement realm throughout Prevea. And there's partial joint replacements for the knee and complete knee replacements. There's also various evolving technologies in knee replacement surgery over the past number of years in terms of multitude of sizes, certain preoperative advanced imaging to get a more customized implant option for them as well.
And what does recovery look like after a knee replacement?
Yeah, recovery after a knee replacement, the first couple weeks aren't necessarily smooth sailing, but we've found ways over the last number of years of speeding up the recovery process. You want to be prepared going in for surgery. We educate you at our orthopedic clinic visit, and then we additionally have set up our Joints in Motion educational program, because that's critical for getting a rapid recovery and the result that you want.
If someone is ready for a new knee, what is one piece of advice you could offer them?
One piece of advice is they need to be on board. It's a team effort. The surgeon's job is done within an hour or two at surgical time, and then their job is just beginning, working hard with the physical therapist. And it's critical. The first 8 weeks are where you need to get your motion gains, and it's a matter of putting in the effort and the time and working diligently with the therapist and the home exercise program to get the result we want for you and the result they want for themselves.
The idea of a knee replacement might be intimidating to some. What does Prevea Orthopedics do to put patients at ease and ensure the best possible outcome for their patients?
Sure. As far as things go, a joint replacement can be intimidating for some. Some people may also be thinking in years past, 10, 15, 20 years ago, people would be in the hospital an extended period of time after a joint replacement. With certain evolution in the way we do joint replacement surgery now and ways that can be improved and optimized, you can get out of the hospital sometimes even the evening of surgery or just the next day. So it's not as much of a significant stay in the hospital as in years past. And we found that patients rather get home anyway and continue their rehab as an outpatient. We also prepare patients before their surgery, in addition to their clinic visit preoperatively, with our Joints in Motion program, which is an educational program we have all of our joint replacement patients go through on what to expect, goes over things in detail on the preoperative and postoperative recovery and what the patient and their family can expect, and also the rehab regimen needed to get the outcome that we want for them and they want for themselves.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.